Next examination is the examination of the hand, checking FDS, that's flexor digitorum superficialis. And this test is done with flexion at the PIP. So the hand is held in extension and the patient is asked to bend the digit. The others, non-examined digits should be held in extension while the flexion is occurring in the tested digit, the thumb also. And this checks FDS at the PIP. The next test checks FDP, which is checked at the, which is examined at the DIP. You have the patient flex and at the same time flex and hold and then apply some resistance. Flex and hold and resistance. Flex, hold, resistance, and flex and hold and resistance. This checks FDP. Okay. Next test is a carpal compression test to check for a carpal tunnel syndrome. You have the patient flex and hold the middle finger, give it some resistance, and you can identify palmaris longus. At that point, relax the finger. You come radial from palmaris longus and you apply downward pressure. If there's any compression of the median nerve, symptoms will be demonstrated in the middle finger, the index finger, and the thumb, and some in the hyperthenar eminence. The Phelan's test. So you have the patient do as you do. So you flex at the wrists, putting the wrists together, keeping the elbows at 90 degrees and the shoulder. You have the patient hold this position. If there is pathology of the median nerve consistent with a carpal tunnel syndrome, the patient will complain of numbness, tingling, burning, or pain in the median nerve distribution, which includes the thumb, the index finger, and the middle finger. Okay. Examination of the thumb for an ulnar collateral ligament injury at the thumb MP joint. The proximal phalanx of the thumb is held, is stabilized between an index and the thumb of the examining hand, and then an ulnar pressure is applied to the thumb, checking the motion at the ulnar collateral ligament. This can also be checked radially, checking the radial collateral ligament, and it can also be tested at the thumb IP joint, both ulnarly and radially. If a patient complains of instability at this joint, this test would be positive and is consistent with a gamekeeper's thumb or a skier's thumb. Always, with any patient who has hypermobility, such as this patient of the thumb ulnar collateral ligament, it should be tested bilaterally to ensure that this is not a normal variant in the patient. And in this patient, this is a normal variant. This is hypermobility at the thumb MP joint. Is the Finkelstein's test. This patient holds the elbows to the sides of the body and at 90 degrees. Palms up. The thumb is put into the palm and the fingers are rolled over the thumb. Wrist is brought back to neutral and then moved in a downward fashion. This deviation ulnarly will put stress on the extensors of the thumb. If the patient complains of thumb pain or pain along the extensor tendon, that is consistent with de Quervain's tenosynovitis.